So, artificial intelligence in the context of neurosurgery. This was my talk today. Uh, I wanted to speak on where do we stand and how to move forward from here. I am Dr. Bhushan Thomre. I have done my MCH from Niemens in 2020. I have learned myself Python, Dart, Arduino, and C++ languages, and been doing ML and DL modeling since 7 years. During residency, I did my thesis on to distinguish between the low and high grade tumor from biopsy tissue obtained intraoperatively. Currently, I am working on projects like AI and traumatic brain injury, data analysis for chronic subdurals, and my current focus is on convolutional neural networks and transformer systems. Currently, I am practicing in Amravati and trying to find ways to implement AI in my practice. So, why should we care about artificial intelligence? There are around 4.6 lakh publications concerned in neurosurgery, which are listed in PubMed, out of which 33,875 were published just last year. And if you consider other scopuses, that goes up to around 22 lakhs. There are also 15,000 patents just related to neurosurgery. So that is a huge amount of data which needs to be correlated, and no single person can do it alone. And even though if you read it, integrating it with each other is a very difficult task. Also, patient outcome nowadays is just not dependent on the mortality or morbidity, but there are other aspects like legal, insurance, and social aspects also. So, to improve our accuracy, planning, simulation, guidance, and monitoring, we can use artificial intelligence in neurosurgery as an assistant to us rather than as a replacement. So, where do we stand today? Artificial intelligence by no means is a new term. It has been first established in 1950s, and the machine learning like algorithms began appearing in 1980s. But there was a long cold winter of artificial intelligence which lasted till 2010, and after which it really picked up, and there is now very deep level advances in this aspect. So what is the difference between conventional algorithms and AI algorithms? In the conventional algorithms, we give the data and we tell what rules to follow on that data. And the program gives us the answer according to those rules. But in algorithms by AI, we provide the data and we give them the expected answers in many cases. And the AI algorithms, by a process called as a training, finds the rules to attach that data with these answers. And then when the next time we give him the new data, it gives the answers for that. So these are the basic terms you should be aware of, like data analysis, machine learning, deep learning, or data. These are the basic terms which everybody knows. For understanding this lecture, you should be aware about like supervised learning, unsupervised learning, or decision boundary like terms. You may not be aware about CNN, LSTM, SVM, or transformer. These are the good to know basis only. So these are the different ML models which can be established. I cannot explain all of them to you because these are more programming level steps, but which are more commonly used, I can tell about, like Markov process, Navier Bayes. There are linear regression and logistic regression, which can help you analyze the data in a more conventional ways. The super vector machines, decision trees, or random forest are used for classification tasks in many a times. The clustering, K-means clustering can be used as an unsupervised learning task. The principal component analysis can be used to reduce the parameters which you are seeing. Like if there are 10 parameters, the PCA can help you reduce it to the most important 3 to 4 parameters. There are others like graph theory, and for reinforcement learning, there are like Monte Carlo methods or Q learning. I cannot go into details due to time constraints. The other different models for deep learning are like recurrent neural networks, like long-term, short-term memory, and various variants of it. For vision tasks, we have convolutional neural networks. For NLP tasks, we have attention networks and other hybrid networks can also be built on it. So the basic things which you should understand is what is the supervised learning first. So in the supervised learning, you provide the data to your algorithm along with the labels like the data and the answers. And it finds the rules by itself by a method called as a backpropagation and gives you the output which is in a form of a model. That model, if you give a new input, can give you the answers based on those rules which it has found. The another method is called as unsupervised learning. In this, you give only data and there are no labels given. The unsupervised learning training uh, segregates those data into different clusters by himself that he might find relevant with each other. And then whenever you give the new data to that model, it will give in the terms of classes like 0, 1, 2, 3, 4. It is your job to label those classes. It cannot label it by itself. It can just give you in the clusters. The third form is the reinforcement learning. In this reinforcement learning, what happens? It is more in the form of a robotic or more in the form of a human nature, where the states and the actions which can be done in those states are provided as an input. The reinforcement learning algorithm learns what are the desired action and then trains itself. Like as an example, I can tell you, in a robot is there who has an camera attached to it. So the states are whatever the camera it is seeing. Like if it is seeing a tumor, it will see as a, it that those will be the states. The action it can do is that it can stay like that, or it can go and grab the tumor tissue. So our action, desired action is that whenever it sees the tumor, it should go and grab it. So these training is done in such reinforcement learning model, and at the end, our model, if you give the states, it can give you the actions which can be done. So hope you understand that. Now just basics about supervised and unsupervised learning training. So here you can see these are the data which is labeled, like this is the data in the form of a scatter plot, and you can see the red labels data and the blue label data. Now when we train it, the decision boundary is a form in a form of rules for segregating those data, and this decision boundary is formed during the training period. Now whenever the new data is given in the form of this random white dot, it tells you that it belongs to the blue cluster. On the other hand, in the unsupervised learning, what happens? You just give them the unlabeled data. The resulting model finds out the clustering by himself. Like here, it has clustered into the four data, while the scatter, you can see that scatter plot are the same, but it has segregated into the four channels because there are no labels to it. And it is your job to label it and take it into perspective. Like this can be of four grades of the tumor, like low grade, second grade, third grade, or high grade tumors. So it is your job to segregate and label those data. Going forward, here you can take it as an example. These are the unlabeled data. Now, some of them are the benign tumors and some of them are the malignant images. So these are given to the model. The feature extractor and classifier model are used for this. And after training, it is able to form a decision boundary between the cancerous and non-cancerous tumors. So, what is actually artificial neuron is? Artificial neuron is just like simplistically, if you can tell, is it just simple equation where the output y is equal to summations of weights and the inputs which are given plus the bias. And what is the neural network? These are the aggregations of these different neurons, and the summation of is done and the output is given as a total. So it is a artificial neural network, the network of this type of neurons. So what do we change? During the training phase, this output might be the wrong. And how wrong we are, according to that, a back propagation algorithms are run, and these weights and biases are changed accordingly to get the desired output. So this might be a little bit complex, and you need not worry about it to understand the practical value of it. So In a practically, if you want to classify, you can classify it as a classification problem, regression problem, associating rule learning, dimensionality reduction, or generative modeling or clustering. In a neurosurgical perspective, that can be in the form of a predictive analysis, classification of tumors, or any other planning or expert system recommendation systems like that. So, what are the neurosurgical applications which are currently present? I cannot definitely give you all the list, but these are the general perspectives. Like utility, what are the utility of artificial intelligence to neurosurgeon? In surgical workflow, there can be utility in the diagnosis, radiomics, decision making, pre-planning, simulation techniques, surgical assistance in form of robots, monitoring and follow-up of the patients. While in non-surgical outflow workflow, it can be used to detect the patient's behavior, doing some administrative tasks, follow-up of those receipts, academic teaching and training, recent publication summarization, and manuscript writing. I will go in some of the details in the following slides. So as you can see, for diagnosis and radiomics, you can do it for tumor identification and delineation. As it can be seen in this image, the tumor is delineated appropriately. You can do volumetrics on this, which can be used to follow-ups for radiotherapy, post-surgical or stereotactic radiosurgery. In a preoperative vascular analysis, also you can do like with this SWO images, a reconstruction is done like in the softwares like FRACLAC. Imaging genomics also, it has taken a lot of efforts. As you can see, just based on the MRI images of T1 contrast, T2 and flare, the IDH status can be recognized with accuracy or area under curve of 0.96. That is very accurate predictions just basing on these four slices. As you can see, other markers like FGMT, H3K27M can also be recognized with such models. There is another utility tool like for prognostication of glioblastoma developed by Harvard Medical School and Brigham Women College, where if you enter the sex, age, race, and other parameters like tumor size and biopsy, whether how much is the reduction, it gives you the individualized Kaplan-Meier curves for that patient, and it can give the estimates of survival if there is nothing is done after surgery, or if you just give the radiotherapy, or if you just give the chemotherapy, or if you give the both of them. How many months survival is expected is given for that particular patient, not just the generalized uh, sense or generalized Kaplan-Meier. In terms of meningioma, it can be used for differentials, like as you can see in this slide, differentiating between hemangioparasitoma or meningioma. Also, it can be used for segmentation, volume analysis, grade prediction, relapse or recurrence rate, or in recent studies, also vascular endothelial growth factor expressions. In a traumatic brain injury, few of the studies I would like to mention, like the Center TBI study, which is segregating the patients is on in using the unsupervised learning predictions. It has fed just not only the clinical data but also the laboratories values and the follow-up values, and it has made a model of unclustered groups like A, B, C, D, E, F, and it is able to give you the mortality predictions for those patients. Another prediction model based on the track TBI data along with the impact model was able to predict the outcome at a 6 month with a accuracy or AUC of 0.92. Other scenarios like for volume quantification of the size of a blood inside a trauma, reporting of the images in cases of emergency, 6 month morbidity or mortality predictions can be done. This is one of my projects which I worked during my MCH residency, where you can find out that what kind of high grade or low grade tumor it is based on the squash obtained intraoperatively. Other studies are also getting done based on the molecular on eosin or hemotaxylin slides. In cases of spinal surgery, there are reports for ODI prediction in the post-operative status, measurements in the spinal surgeries of screws and other parameters, pathology identification, like what type of tumor you are dealing with, patient-specific prognostication for such cases, like for failed back syndromes. Another interesting use was identification of the manufacturer of the implants which are used in the cervical anterior cervical spinal hard cases. Similar cases can be found in vascular surgeries, like for example in endovascular procedure, occlusion prediction, type of device selection, complication detection are automated with this. Connectomics, as mentioned by previous author, and surgical assistance, robotic surgery, monitoring, and follow-up can be used. So, how to use it in the non-surgical workflow? For like neurosurgical simulations and result prediction, it can be used for resident training and to analyze their results. It can be used for bed allotment of the patient and staff management. It can be used in academic research. It can use like if you have like recent 100 paper published in the last 6 months about some topic, you can download it, feed it into a network, and it can summarize you nicely about those papers, avoiding the pain of going through all those 100 papers. It can also help you in the patient workflow management, and the tools like ChatGPT, which are coming up, can help you in the academic manuscript writing. But it doesn't come without downsides. What are the direct disadvantage to a neurosurgeon? It can lead to inadequate training of residents. Poor understanding of the basics can cause biases. It can cause fear of missing out, that you are not understanding something while doing something and just relying on the AI. It can it can give you the reasons to justify your surgical errors. It can the as the algorithms many a times can be just a black boxes which you might not be able to dissect the way you should. Also, it can be very contextualized. Single task can be predicted with such algorithm. Like if the model is to detect only high grade versus low grade, it will just do that job. It cannot do other jobs. So it can cause to the contextualization to a single task, and it lacks generalization in that sense. What are the indirect disadvantage? It can cause descaling, overconfidence of a neurosurgeon. It can cause lack of vigilance from the authorities about of your surgical skills. Automatic workflow might have a biases of its own due to data overfitting, and there might be regulatory issues like who is responsible at what time. So, how to move forward? So there is a scientific process which you should follow. Like if you have a question, you should study it, hypothesize something, test it, and then access and report it. And then again ask question based on those reports. So this is a scientific method about any process. So AI can help you in each and every step. So how to choose your projects? So you should find eligible project into your practice by following such criterias, like the project which you are choosing should be clinically relevant as it should be for other projects also. But for AI, the reason to select or to solve that problem with the AI can be based on if it is more on the pattern recognition, or there are repetitive tasks done due to that, or if there is a training data which is adequately large and it can be digitally transferred, then such kind of project can help you develop or solve the problems with the help of AI. As we are going more and more into the precision medicine, you have to go beyond signs and symptoms, and you have to personalize the treatment as well as prognostication for that patient. For any AI model generation, you have to understand that the data is the most important things. If your data is a garbage, whatever you get or whatever the models are generated on it will be a garbage. So there is a term used for it in AI called as a garbage in and garbage out. So you should be very careful about what kind of data you are feeding to your network. For further reading, you can go through AI Wiki, which will give you basic concepts about artificial intelligence. A glossary of terms can be seen if you're not understanding while reading your some papers on AI. You can go to this website and find out the what does it actually means. Other documentation like PyTorch and TensorFlow you can do. Thank you. I hope you will find some value in it.